What's the appropriate management and investigation of aortic dissection in the emergency department? Well, let's start with the investigations first. There's not really any blood tests that are super helpful. The D-dimer is somewhat helpful in that you're unlikely to have dissection if you have a negative D-dimer, but unfortunately that's really not a good enough test to rule out dissection. I'm going to leave the imaging discussion and just say that the test is a CT aortogram. There are a few other tests if you're a specialist and if you have special expertise, but for most people, the readily available accurate test is a CT scan of the aorta. What about the management of aortic dissection? Well, of course, you'll have to resuscitate the patient, and this might involve giving them some oxygen. Blood pressure management is also very, very important. And what you're trying to do is limit the extension of the dissection flap along the walls of the aorta. So to do that, you want to have a blood pressure of between 100 and 120 millimeters of mercury systolic. You might need to use a beta blocker like labetalol to achieve this. The other thing that's important is rate control. So for the same reason you don't want the flap to extend, you want to keep them rate controlled at a heart rate of 60 to 80. And hopefully the beta blocker you use will help do this. And then the other thing to remember is you're going to have to call for definitive management soon. So you want to get the surgeons involved earlier. And that could be cardiothoracic or vascular, depending on where exactly the dissection is, or it could be both.